Good morning. Thank you very much. And I really enjoyed the presentation of Susan and of Fiona. Thank you very much. Who's not from UK here? Can you raise your hand? Okay, not that many. Who is from a low or middle income country? Ooh la la. Okay, one person. Okay, who's not a doctor here? Okay, that's good news. That's good news because we cannot fight AMR with only doctors. So that's it. But in fact, what are you then? Are you vets or dentists or? Okay, okay, fantastic. Now I would like to give you a kind of global perspective. And what is this scene? I don't know whether everyone is familiar with all these bugs, but this is Klebsiella pneumoniae. It can cause a urinary tract infection, bloodstream infection, but if you have this bug that is resistant against carbapenem, which is a last resort antibiotic, mortality rate is 50%. 50%. This is the map of 2010 and 2016. The red areas do have a resistance of more than 25 or 50%, the dark red. You see there is a very clear increase. Now I go to another one, A-bacter, and again, if there's a multi-drug resistant A-bacter, mortality is 30%. You see here, there is a very impressive increase. The last graph I would like to show you here is this one here. This is the hospital superbug, MRSA. And again, you can see differences. But I will come back to this slide because this is a very interesting map. I think we have already discussed here, Susan has mentioned that, in fact, modern medicine really depends on effective antimicrobial treatment. If we don't have treatment, it's not possible to have transplantation, have cancer treatment. It all depends on antimicrobials. But that's not the only thing. Also, food production depends on antibiotics. Now, if you look at what is in fact contributing to AMR, it's the overuse and it's the misuse of antimicrobials in both human sector and in animal sector. I was very glad that someone of you mentioned animal sector here and asked about diagnostics in animal sector. That's extremely important. But also here in this graph, it's not very easy to indicate it here, is the IPC infection prevention. Now, you have seen that the consumption in England is decreasing, at least in community. But in general, the consumption of antimicrobials is increasing. And imagine that the demand for animal proteins in Pakistan, in India, in China is really increasing. And that will result in an increase in the use of antimicrobials, unfortunately. So there will be a huge increase in the coming decades. And AMR will also touch on the SDGs, not only on the third one, which is about health, but also on the food production and treatable infections in animals. It's also about poor people. It's about environmental protection. It's about costs, as Jim O'Neill has indicated, and it's about innovation of new antimicrobials. Now, 3 years ago, the member states of the World Health Organization and the Assembly, they have agreed on a global action plan. And the global action plan should be done in a holistic way together, animal side, agriculture side, and that's why there is a global action plan of 3 organizations, WHO, but also FAO, Food and Agriculture Organization, and the OAE, that's the World Animal Health Organization. They also mentioned it's a good idea to bring this whole topic AMR to the UN General Assembly. And that has happened a year after that. So what are the elements of this global action plan? First of all, improve awareness and understanding. And that's why I'm extremely pleased that you have organized this meeting, because this is about awareness, this is about understanding. But also understand what is the actual situation, the surveillance, and reduce infection and prevention. I will come back to all these elements. Optimize the use of antimicrobial medicine, stewardship has been mentioned here, and sustainable investment. The member states also agreed that each member state should develop their own national action plan for AMR. This is interesting. This is a picture of Europe. It's the use of antibiotics in all EU countries, and in fact there is a 3-fold difference between the high and the high consumption and the low consumption. UK is, by the way, in the middle. Now, how come? Are people in France less healthy compared to Netherlands, Germany, Austria? Of course not. This is something that has to do with culture, with expectations. I go to a doctor, I pay a fee for the doctor, and I really would like to get something in return. I would like to have a goodie. This is a picture of the use in animal sector here, again in Europe. Now, I think the difference is, I thought about 80 between a high-consuming country, that's Spain, and I will come back to Spain, and Norway. And as you know, it's about awareness, it's about behavior. That's why I really like your posters here. I was very impressed. But if you ask the doctors, the family practitioners in the high-consuming countries, 50% of them experience that there is a huge pressure from the patients to prescribe, to get antibiotics. And that's very difficult to resist, because if they resist, they go to another doctor. So we have developed the World Antibiotic Awareness Week, and I have seen that, I have recognized the logo on some posters. We were very glad that more than 130 countries participated in this Global Antibiotic Awareness Week. They had their own campaign, or they used elements from WHO. A lot of activities, and I really hope for the next campaign that we also can count on you. This is an example that I very much like, and I have visited this, this group. I have also seen from Malaysia that you have done the work, but this is in Thailand. They have a campaign that is running for 10 years. It's the Use Smart Antibiotics campaign. And they really, it's a multi-community campaign. They train children, they train even religious people, and to understand that for a sore throat, upper respiratory infection, for diarrhea, you don't need antibiotics. What is needed is that you follow up. And that's what I also like from your flyer, that you should understand that within a couple of days it is self-limiting. So just wait and check. And they were able to reduce, by having this campaign, maybe you can't see it, but it's there, that the use has been reduced by 50%. You see children, they use a booklet with understanding the basics of antibiotics. And there is a monk that is also involved in this campaign. Now, we would like to know what's going on. Surveillance, very happy that more than almost 70 countries are now enrolled in the global antimicrobial resistance surveillance system. You see here a graph. Reduce the incidence of infection. And I have shown this map. And maybe you have noticed, if you look at UK, that UK is one of the few countries that was able to change the tide. They went from red to yellow. And there was I don't know the details, but they told me that there was a very active campaign on infection prevention in hospitals in order to really reduce this MRSA. And I think that is a big achievement, and I always show this slide because people need to understand that there is also positive news, that we can do things, that we really can make a change. So we have in May, it's the Hand Hygiene Week. I don't know whether you are aware of that. This is a picture I got from a colleague. It's about antibiotic stewardship. It's only, you know, when it's needed, the right dose, etc. But then I saw this, I got from someone a picture like this. It's not a sign of ceftriaxone deficiency. So, you know, this is very funny, but I will come back to this picture. I was very impressed to learn that in UK, you have also paid attention to the use of antibiotics in dentistry. And I think this is very important. And again, this is about behavior. This is about understanding that you don't need always antibiotics if you go to a dentist. I think this is a very good example. And actually, I haven't seen that many of these campaigns in this field. I promised the organizers that I would serve fresh bread, and you know, this is a picture I got from last night. This is a study in Canada, and again, Cif diff is a very difficult bug, but again, they were able to, by paying attention to IPC, to reduce the infections in healthcare settings. So I think this is a very nice example. Of course we would like to have new antibiotics, but it doesn't look very promising. We have looked at what are the most important pathogens. Of course the gram negatives are very important. We look what's in the pipeline. We have seen about 9 are really innovative, but we expect only 1 or 2 in the coming 7 years. So this is not looking good. It is very difficult, although a lot of organizations do pay attention to this. Now, I'm glad that you have mentioned animal sector. You can only fight AMR if you really pay attention to agriculture in a joint effort. WHO has developed a guideline for the use of medically important antibiotics in the food-producing animals. This is important because for antibiotics in human use, we need to be sure that they are not used that often in food-producing animals. The guideline is that you should not use these antibiotics as a growth promoter. You should not use it for preventive use, prophylactic use, unless there is a very clear reason why there is no alternative. And if you really need to use antimicrobials for a sick animal, and of course that can be necessary, you should start with, let's say, the simple antibiotics and only then scale up to the more advanced. Now, I was very happy to learn about the results of the British Poultry Council. They were able to reduce the use of medically important antimicrobials by, I think, by more than 71. I think the real figure is higher. Is someone here from this organization? I think it's higher. Is it about 80%? 82, sorry. But even better news is that the production did not decrease, even increased. And I asked the organization, so what did it cost? And they told me it's kind of mental change. It is not a big thing that you need to invest a lot of money. Now, I have shown you a picture of Spain, and Spain was very high in the use of, for example, colistin. And colistin it's the very, very last antibiotic for gram-negative bacteria. The consumption in pigs in Spain, and they develop a kind of action plan for colistin reduction. And you can see the results here. There is a clear decrease in the use of colistin, and there is no increase in alternative antimicrobials. So this looks very promising. We are also very glad with pressure from civil society, consumer organizations, and I don't know whether you are aware, but in several American fast food chains, you can see that there is a label that we serve antibiotic-free meat. And that's really great. Of course, it is a little bit kind of soundbite, but what I mean is the animals have been raised without medically important antimicrobials. And this is very important because consumers really are aware of that. And by having this public interest research group, they were able to show the results. Now, countries have developed their national action plan. Nowadays, about 100 countries have an improved multi-sectoral national action plan. 67 countries in progress, so that looks promising, but of course it is all about implementing the plans and not having only a plan. But I would like to show you a few other pictures of another part of the world. We are talking about AMR in UK in a European setting. But if you look at the impact of AMR, and this is again a picture from the report of Lord Jim O'Neill, we can see that it is in particular in the African continent. And of course the burden of disease is much higher in the African continent. Now I could show you pictures of the number of nurses and doctors in this continent, but that's very low compared to European countries. Now again, if you look here at the left side, it's the burden of infectious disease, and again you can see the red areas are in African continent, or it's white because we don't have any information, but I can assure you it should be red. And if we look at the progress in developing a national action plan, it's the opposite. It's again the African continent that has no national action plans, and they really need these plans. So that's why it is so important that we pay attention to this. And water and sanitation, it has been mentioned. To be quite honest, I didn't know that 40% of the health facilities in lower middle income countries have no source of water. How can you call this a health facility if you have no water? This is really unbelievable. And I have seen, I don't know whether you know the site of WaterAid, they have a very interesting video clip of a woman who is giving birth, and the screen is divided in two parts. One part is in UK and one part is in an African country. Has any one of you seen this? Have a look. You will really be touched by that. As mentioned, hospital water sources is a problem. Now, this is a picture of a colleague from India. In India, you see again a sharp increase in the use of antimicrobials. There are a lot of what we call irrational fixed drug combinations, combinations that are not authorized, self-medication, diagnostic uncertainty, broad spectrum antimicrobials, and incentives offered by pharmaceutical companies. This is a picture I got from a student from London. She was very glad to see that on the door there is an indication that the medical representatives are not allowed to visit the doctor. That's a good sign. But then she also discovered that all the art on the wall were gifts from pharmaceutical industry. So this is still reality in parts of the world. Now, these are pictures I took actually 2 weeks ago, and you know, I don't want to mention the country, and that doesn't matter. As you can see, it's an African country. And this is, while I was sitting in the car, I could see on the street kind of these people were selling, I think it's ibuprofen, but also antimicrobials. It's not very visible, but when I went in a shop, and there were several of these shops, I found this. And if you look better, you'll find this here, Cypro 500 milligram, and also this ceftriaxone. You remember the girl with the t-shirt. So I asked them, wow, why should I buy this? You know, what is the reason? When can I use this? And of course, the person behind the badge didn't know anything. I said, you know, it helps for everything. If you don't feel well, just buy it. Now, and we bought it because we thought maybe it's better to buy it, because, you know, for several reasons. This is what we found. And actually, we don't know whether this is a fake drug and whether it is effective or not. This is a big issue in a lot of countries, counterfeit, falsified medicine. Now, we are talking about labs, and I was very glad with your presentation, Fiona, but this is a picture of a 3,000 hospital, academic hospital. I always want to go to labs because I'm a medical microbiologist, and I ask them, how many staff do you have? 10. They had no training for the last years. This made me very sad. But we should also realize that a lot of antibiotics in these countries are in fact a substitute for sanitation, for what we consider as normal health facilities. And then you can see these situations. And, you know, just take antibiotics in case of. You deliver a baby, and, you know, it's good to have antibiotics. This is what's happening, a substitute for decent care. And in fact, this is the same in animal sector, where we treat the animals in a way that sometimes we need to have a lot of antibiotics, not to treat animals for sickness, because we know very well there are several examples. If you have good animal husbandry, you don't need these antibiotics. So, can you make a difference? Yes, you can. You can. Prescribe antibiotics only when it is necessary. Use diagnostics when that's appropriate. That's not always necessary, but when it's appropriate. But also vaccinate your patients. Vaccination is still a cornerstone of medicine. And educate your patients. Tell them why it is not necessary. And I have seen really very good examples here on the posters, and I'm very glad that students are active in this field. But also, if you are not a politician, try to get attention from policymakers, because, you know, as a doctor, I didn't realize in my career how important political support is. But that is really important. Look at Jim O'Neill. He's a politician, but he has done fantastic work to get AMR on the political agenda. And I would really pay tribute to UK, who is extremely important on the AMR in a global perspective. Sally Davis and Jim O'Neill, really global advocates for this. The Wellcome Trust, who is doing fantastic work. The Fleming Fund, I don't know whether everyone is aware of the Fleming Fund. They support lower and middle income countries and many more, and I mentioned water aid. Conclusion, you are needed. We need your support. Whether you are a doctor or not, that doesn't matter. We need your support. There is no silver bullet. If I get interviews, they always ask me, so what is the solution? No, there is no silver bullet. And a new antibiotic will not solve this problem. So a lot of actions are required. Now, progress is made in countries, that's great. Political attention is great, but we are not there yet. Resources are needed at all levels. And a basic problem in several of the countries I showed you in the second part of my presentation is that they don't have an adequate health system. So we need to support these countries in developing their health system. Thank you very much, and I count on your support and advocacy.